Dr. Sareen, first of all, let's talk about antigen tests, right? There are a record number of false negatives that come up. So do you think that this will give us a false notion of all is well if we continue with these antigen tests? False negatives will keep bloating the number of people we have added and the report of people testing negative, whereas that may not necessarily be the reality.
You have hit the nail. The difference between the RT-PCR, the gold standard, and the antigen test is that you have much lesser capacity of finding the level of the virus. If the virus level is low, the antigen test will be negative. So you may have a false negative in about 15% of the people. And because of that, the actual numbers may not be there. And that's where the community can be. So this is not the problem of the country. It's all over the world that this is a new disease, new virus, and the tests are not sensitive enough. So we should have those which are negative, but you have a suspicion in a given area. A second antigen test should be done, maybe when the virus levels are high. So maybe after 5 days or so. But what is worrisome is the exposure rate. 23% of the people in Delhi were positive. While when you test by the antigen or RT-PCR, only 0.6% were positive.
Correct.
You know, 1,60,000 out of 2 crores. So we have missed a lot, and therefore the virus was.
It's a very important point. It's a very important point because, you know, Dr. Jawali. Yes, Dr. Jawali, I want to bring you in. Dr. Sareen mentions a very important point about the Delhi Sero survey. I'm sure we will see similar results in other cities as well. If 23% of Delhi was affected, were we giving ourselves a false notion again that all is well because these cases were never reported?
Correct. See, Sanket, what happens is this corona pandemic will go through 4 phases. The foreigners, people coming from abroad bringing the disease. Number 2, the clusters. And then later on it will go to community. And number 4, the country. A country like us, which is so chaotic, is not possible that we will not go to phase 3 and phase 4, and we are going. But we took time and we reached slowly there. Let us not sensationalize. What is the Brazil population? 21 crores. What is the United States population? 33 crores. So we cannot say we have got 50,000 cases and we compare that with USA. We compare it per million, this many cases. Number 2, we should not forget to talk about fatality rate, and we should not forget about talking recovery rate. Sure. We are far better. There is really not such a big panic, but I think we will go through these phases. Then there will be plateau, and then we will come down. If you watch the
Dr.
USA,
Jawali,
the New York, Spain, everywhere.
Correct. Dr. Jawali, the purpose of this discussion is certainly not to spread panic. I agree with you 100% that on certain parameters, in fact on crucial parameters, things may not be as alarming as they appear. But at the same time, there will be important questions raised on our learnings from the past, especially now that this virus is traveling inwards. So I want to come to you. Yes, you wanted to say something, Dr. Jawali.
2 things. A, we should not reinvent the wheel. What mistakes Bombay did, what mistakes Delhi did, Bangalore should not do. We have done right things to prevent as much as possible. We have reached this 4th phase. Now the important mistakes that we are making is at the management of already infected patients. As you said, capacity of beds. We have got enough beds, but we are not distributing them properly. We are not to allow the asymptomatic or mildly symptomatic patients to hog the beds in a hospital with a good ICU muscle. These patients have to go to isolation places, and there people are not going to government places because the hygiene is not good, food is not good. We have to go on an overnight war, 3 shifts, and within 1 day we can solve that problem. But we are struggling at that lower bureaucracy level. There are these mistakes, but otherwise these numbers are raging. I think we have done enough, and this is it. And it will go to that particular level and it will plateau.